Meet Jason Martin, a softball player who logs over 100 games a year in leagues, tournaments, and even World Series appearances.
We're, like you say, weekend warriors, and we take it really serious. We call it competitive. You know, we're in our uniforms and our $300 bats, and when you tell somebody at work, they're thinking you're out, you know, with the family reunion or something. So it's a little difficult to try to get that point across and make it sound serious.
While Jason is aware of this perception others may have, there is no gray area about the serious injuries that can happen in any sport.
I dove for a ball in the outfield and came up short and just landed on my elbow, and that's why I felt it in my shoulder. I couldn't throw. I couldn't make the throw to get up when I got up.
Fortunately for Jason, his wife Mary knew where he should go.
She said, Dr. Lemos, he's the guy. He works with the Tigers. He does all their surgeries. He's their team physician. He'll take care of you and get you back ready on the field.
So Jason visited Dr. Stephen Lemos, one of the DMC sports medicine specialty physicians. Besides being team physician for the Detroit Tigers, as Jason pointed out, Dr. Lemos serves in the same role for the Detroit Pistons. DMC Sports Medicine also provides care to the Detroit Red Wings.
We've learned a lot of things by taking care of the athletes, and we've brought that to taking care of the general patient population.
Tell us about your visit to the doctor and his prognosis.
Well, his prognosis was a torn rotator cuff. He was able to tell me exactly where the injury was at, exactly what they're going to do, and exactly how it was going to be fixed, and pretty much exactly when I'm going to be back on the field.
The rotator cuff is made of 4 muscles. The 4 muscles, if this would be the shoulder, the ball part of the ball and socket joint, and here is the socket, the muscles surround the ball like so. The reason it's so important is the rotator cuff, or in the shoulder joint, is a ball and socket joint, but the socket is very shallow. It's more like a saucer than a cup. And because of that, the ball can slide back and forth. So the rotator cuff, along with the soft tissue and the capsule, keep that shoulder in place. The rotator cuff, as demonstrated here, surrounds the shoulder, as you can see. This muscle on top is called the supraspinatus, and actually that's the one that's most often torn. The subscapularis is in the front here, and in the back are the infraspinatus and teres minor. The different muscles do different things. The supraspinatus allows you to bring your arm out to the side.
That's the one on the top.
The one on the top. And the one in the front, the subscapularis, allows you to bring the shoulder in like this. And the 2 in the back, the infraspinatus and teres minor, allow you to do this with your shoulder. So that's basically all the motions of the shoulder. People that have rotator cuff tears, there are several things that may indicate they have one. One is pain with reaching overhead. The other is, and the one that brings most people to my office, is difficulty sleeping because of the pain.
There are many forms of treatment for rotator cuff tears depending on the severity of the tear. In cases where medication or physical therapy will not suffice, arthroscopic surgery can be the best answer.
Arthroscopic surgery has many benefits over the open surgery. Actually, seeing is easier with a camera than through what's a larger hole than I use with the camera, but a very small hole when you think of it in the general scheme of things, because you have to make the incision, split the muscle, and look down through, whereas with the camera I'm looking right at the tear. So it really helps a lot to repair the tear anatomically. Trauma is less to the shoulder because you're not splitting the muscle, and that helps to lead to a faster recovery. Also, because you're not creating that trauma to the shoulder, you have less stiffness after the surgery, and that really goes a long way to speeding the patient's recovery and decreasing the patient's pain.
Dr. Lemos performs the surgery on Jason by shaving away fragments of the muscle tear. He inserts a bioabsorbable suture anchor into the bone and then sews the muscle back together with 4 sutures and secures it all with a second suture anchor. The surgery is successful. Now it's on to rehab.
I tell my patients that for 1.5 to 2 years, they have to do the exercises that they're giving. They don't take that long, about 20 minutes a day, but what that does is keep the shoulder healthy, prevent the shoulder from riding up and damaging the repair.
I feel very happy, definitely very happy. You do not hesitate to contact the DMC and take your ailment to them and let them fix it, because, you know, honestly, through the whole process, step 1 to the last step, it's been great.
And Jason will be swinging his bat on the baseball diamond again with no pain. To learn more about rotator cuff surgery or to schedule an appointment with Dr. Stephen Lemos or another of the DMC Sports Medicine specialty physicians, log on to dmc.org or call 888-DMC-2500. I'm Emory King.